discussing hospice care while you're healthy. Hello, I'm Kelly Lynn, and this is Comcast Newsmakers. Joining me at this hour is Brenda Laughhunn. She is Executive Director of Calvert Hospice. Welcome.
Thank you. It's good to be here.
Well, congratulations. You're just taking this Executive Director position. What do you hope to bring to Calvert Hospice?
I'm hoping to bring my passion for end-of-life care. I've been a nurse for 22 years and been in hospice for the last 12 to 13 years and have lived basically a lot of places across the United States, with my husband being in the military. So I've had the opportunity to work in end-of-life care across a wide diversity of cultures, and hoping to bring some experience and new tools to Calvert Hospice and how we can deliver end-of-life care.
Let's talk a little bit about hospice. Why don't you explain exactly what hospice is, and tell me about some of the newer changes that are taking place in the field.
Okay. Hospice is a support for people that are experiencing a life-limiting illness, and they're seeking possibly to have comfort care versus curative measures done with a disease process.
What people don't realize is that there are various versions of hospice. Why don't you explain? You could do hospice at a house, at a facility. You could also do it in your own home.
That is exactly correct. And we also, Calvert Hospice has a hospice house, and but home, wherever home is where hospice goes, wherever you call home.
Yes, there's also, define the difference between hospice care and respite care.
Respite care is what we call time out for the family. It's a limited amount of time where the family can have a few days off. So caregivers that need some time to maybe take care of some personal things, or something's going on in the family where they need to be away and yet the loved one is not able to travel, then that's what respite care is. It's basically what we call time out.
Is hospice care covered by insurance?
Yes, it is. It many times mirrors or is like the Medicare hospice benefit.
Very nice. And I think it's a topic that many people find difficult to broach. What would you recommend? How do people even bring it up to maybe a loved one? You say talk about it before a person gets sick.
Absolutely. What we see so much of the time is people get into a crisis, and then they're trying to figure out what is the best thing. What would their loved one like to do, focusing on as far as what quality of life measures would really be important to focus on. So we encourage families and patients to talk with your family. What are your wishes when you come to that place in life where you're not sure that the quality of life is what it could be? And so, you know, whether or not you want to seek curative measures or comfort measures, we're focusing on quality of life. So we're not looking at extending life, but enhancing life along the journey.
You encourage the public to make the referral. How would that work?
That can be made a couple different ways. First of all, you can go to our website, calverthospice.org, and get more information, look at our program and what we're about. We are a not-for-profit program. We've been in Calvert County 27 years and are very proud of our heritage. You can also call our office, and that number is 410-535-0892, and you can speak with someone that would be very happy to answer any questions, to even make a courtesy visit to explain with you and your family what hospice is and how it might be a support.
All right, so if you have a friend who's dealing with a loved one who maybe at the end of life has not yet considered hospice, you're encouraging people to not be afraid to bring it up.
Absolutely. Hospice, for those who have Medicare, is a benefit for them. So it's an option that's there for support. And many people who have private insurance, it's an option for support.
All right, Brenda Laughhunn, thanks so much for coming in.
Thank you.
And we thank you for watching Comcast Newsmakers. If you would like more information about events happening in your community, go to Comcast On Demand and click Get Local. I'm Kelly Lynn. Have a great one.